When you hear me say nothing about patients without patience, what do you think I mean? I heard this mantra from Barbara Lewis, who is a patient advocate and the founder of Joan's Family Bill of Rights, and she's with me today to say more. Barbara, I'm thrilled to have you on the show. As viewers may know, I'm a huge fan of the patient perspective, having been someone who lives with MS, and I would love for you to start with the story of how this came to be.
Well, thank you very much for inviting me. I appreciate being here. In 2012, I spent 2 weeks in the ICU with my sister, and the first week she was getting better, and I was writing down all the things that were happening to customer service because I had been in marketing for 2.5 decades. And I was very curious about the customer service that was going on in the hospital. And unfortunately, she took a turn for the worse the second week, and she passed away. But I took the document called Joan's Family Bill of Rights and I sent it to the head of the ICU, who later told me she cried when she read it. She passed it along to the CEO and he sent it to the heads of the health system. So they flew me across the country to make 3 presentations at their facilities, which they videotaped as the cornerstone of their training program. And I was thrilled to give my sister a voice. I was so happy. But what happened was, after each presentation, there were a line of people to talk to me about their stories. Let me tell you what happened to my father. Let me tell you about my daughter. And what I realized is that it wasn't my personal story. It was really a universal narrative. So I had to do something about that, and I decided to give up my marketing company and to devote the rest of my life to improving the patient experience.
Wow. So tell me how that is playing out in terms of what you're doing.
Everything that I do is with organizations who align with my mission, and that is to improve the patient experience. So it's volunteer work, it's working with medical schools, it's working with organizations, all of which are interested in improving the patient experience.
So I feel like there are kind of almost 2 parts of what you're doing, because certainly being within a hospital process and having a better patient experience is one thing, but I think there's a greater kind of domain that you're doing that's super important, and that is actually being able to prove the value of a patient voice. So certainly when you're in a healthcare moment, so you know you're going to cry and there's a box of Kleenex there, somebody's thought that out, that's one thing. But I know that you're also working on a bigger level that has to do with revenue.
Right, that's right. So what happened to me actually was that I had a conversation, a conference call with a number of people, and I was very interested in patient and family advisory councils, which are the councils in hospitals that advise the hospitals about patient-facing initiatives. And a woman there said, my CEO will not start a patient family advisory council known as a PFAC because there's no business case. So armed with my MBA, I decided to build a business case. And I thought, I'll knock this project off in a month or 2. Well, 6 months later, I was still working on it because I sent 2 surveys out to thousands of hospitals. I contacted a ton of listservs, and I got great examples of how listening to the patient voice is really prudent.
What was your, in those moments, what was your hypothesis? The initial thing you were trying to prove?
That the patient voice could save hospitals money, improve safety, and enhance the patient experience. So I had 3 things that I was looking at. Right.
So give me an example of when those people were writing back and they had some great, as you said, examples. Tell me some.
Okay, so which would you like to know? Safety, finance, patient experience?
Okay,
let's start with finance.
The bottom line.
Let's start with finance. So one hospital decided that they needed new chairs for their infusion unit, and they brought the chair that they were planning to buy into the patients, the PFAC, and said, sit in this and tell us what you think. And the patients sat, and there were, along the armrests, there were all sorts of bells and whistles, and the patient said, no, we don't need this. We come with our iPads, we're watching movies, we have our cells, we don't need the bells and whistles. And then the chair goes back and the leg lifts up, and what happened was that it was catching people right in the middle of their calf. So the people with diabetics, it actually hurt them.
Wow.
So they said, no, don't buy this chair. We're fine with what we have, and they saved the hospital over $500,000.
Wow.
So PFACs, most people think that PFACs will cost hospitals money, but that's not the case at all.
Wow. It's funny, I think about, on a consumer side that I think we're so appreciative, if not dependent on that type of consumer perspective. I mean, you go on a restaurant, you go to Yelp and you want to know what other people think. Amazon, I often read reviews.
Netflix.
Yeah, gauging.
United, I just flew here, I got a survey immediately. We're always asking the customers. We're very customer centric. It hasn't happened that much in healthcare, but it's moving in that direction and I'm really happy.
So as you talk about these family councils, can you speak about how that has expanded from your lens?
So when I first started doing the research, there were about 20% of hospitals that had patient family advisory councils, and my understanding now from recent research is that it's up to 80% have PFACs. And this is wonderful.
Yeah.
And the PFAC has actually changed over the course of those years.
Yeah. In terms of?
So what happened is initially the departments would come into the PFAC and say, okay, what do you think about this? What do you think of that? And it was a rubber stamp. It's good, we sign off on it. So it was just kind of an approval. But now we've actually moved to a point of co-designing.
Wow.
Where from the get-go, a patient is involved. And there are some health institutions that if you're doing an initiative or any kind of a project, you better have a patient in on the ground floor because that's how important it is.
COVID was a time certainly where I think patients were isolated and kind of took away from kind of a collaborative experience. It's clear talking to people in lots of different sectors here that we are at an inflection point of change. How do you think COVID is going to affect your mission?
So a couple of ways. One is that now we've gone virtual, so now it's easier to have a PFAC. And now we can reach the disenfranchised and other people who maybe can't get to a hospital for 3 hours every month to talk about issues. So I think that PFACs are going to become much more widespread. There are some institutions and hospitals that have 20 PFACs, and they're in all different areas of the hospital. But most of them actually are brought together at one time, and now I don't think that that's the case. I think that, we're going to be virtual with it.
Yeah, and more
And then I think the second thing is that for people like me who are patient advocates, I think that something needs to be done about the fact that we couldn't be at the bedside. And I don't know the research on the safety, but I know that patient advocates help with safety. They help with care of patients, and that didn't happen. And I've heard anecdotally that safety was not up as high as it should be during that time because of the challenges they had with just the patient in the bed and not an advocate or a caregiver.
Wow. Well, Barbara, I am super excited to meet you. I also appreciate the fact that although you lost your sister, Joan, I like to think that she is here. And I do feel like some of the best things that come out of healthcare in terms of innovation and change come from a moment that's super difficult and a shared experience that was incredibly tough. And it is a pleasure to hear what you're up to. I'm really happy to have you here, and I look forward to seeing what happens.
Thank you so much.
Thank you so much for your time.